MAPV Access Program presents Accessible Pharmacy.
Hello, Jerry Feliz here with you and my colleague Rachel Castle and Evie Dell, and we have many other guests here as well. I want to welcome Accessible Pharmacy. We are going to be hosting them today. A little background: Accessible Pharmacy Services is a comprehensive home delivery pharmacy service specializing in the needs of the blind and low vision community. Welcome, Andy. Welcome, Patrick.
Wonderful. Thank you, Jerry. My name is Patrick Olson, and I am the New England Director for Accessible Pharmacy Services for the Blind. I'd like to thank you and everyone at MAB and say hello to our friends at MCB. But I'd also like to thank all the consumers for joining us today. And I'm delighted to be able to speak as well to the staff of all agencies and organizations. Today, we're having an informational meeting, and we are ably joined today by my counterpart in the Mid-Atlantic, Alexandra Luzier, who will be joining us and presenting. And we are happy to announce that our founder, Dr. Alex Cohen, PhD, is also with us on the line today. Alex is also a teaching professor at Westchester University in Pennsylvania. And today I am happy to be with our president, Andy Burstein. Andy, would you like to take over?
Well, thank you for that awesome introduction, Patrick. Thank you so much, everyone. And once again, Jerry and Bill, thank you again for setting this up for us. We really appreciate it. So as Patrick mentioned, we are Accessible Pharmacy Services for the Blind. Our headquarters is in suburban Philadelphia. We just recently, within the last, 2 months, got licensed to be able to provide our services into the state of Massachusetts. The highest level overview of us is we are a home delivery pharmacy that specializes in the blind and low vision community. And I'm going to pass this over to Alex so he can give a little bit of background about himself and the origin about how we came into being. And then we'll start to dig into some topics. And at the end, we'd love to hear some questions and some feedback and some thoughts so that we can have a dialogue. So hit it, Alex.
Well, thank you very much, Andy. And thank you, everybody, for having me. And before I get started talking about accessible pharmacy services and our origin and how all of these great services came to be, I first have to mention, so I was diagnosed with retinitis pigmentosa well over 25 years ago. And like Boston, I live in Philadelphia, which is quite a hotbed of eye disease research. So I went to Wills Eye Hospital where I was diagnosed with retinitis pigmentosa and said, great, what do we do about this? And they said, well, there's not really a cure or anything happening right now, but there's this guy in Boston out of Harvard at Massachusetts Eye and Ear Infirmary that I want to connect you with. And that began a long, decade-long wonderful relationship with Dr. Elliot Burson, who passed away a few years ago, but his position is well represented in the mantle has been passed to Dr. Pierce from the Children's Hospital of Philadelphia. So making semi-annual trips to Boston for checkups and examinations, it was a wonderful experience while it lasted. But again, my name is Alex Cohen, and I am a proud co-founder of Accessible Pharmacy Services. And so I'm not just the co-founder, I'm also a patient. So as I made a career change, I decided to pursue my doctorate from Drexel University here in Philadelphia in marketing. And while I was working on my dissertation, which was all about how to create a more inclusive marketplace, both online and offline, for the disabled community, but more specifically, the blind and low vision community. And so first, this led me to evaluate the online marketplace and the accessibility of retail websites. and through extensive, exhaustive evaluations, determined that they're all terrible. But of particular note, pharmacies really were not promoting a good or accessible online environment for the blind or low vision community using screen readers, or anybody who might have difficulty using a point and click device like a mouse. So looking further into pharmacies, not just in standalone pharmacies, but also in big box retailers or large grocery stores, it was the same story where the online environment really was not accessible. And so this led to further research where I started doing surveys and some field work and going into several different pharmacies and just asking questions. Hey, what do you do for people who are blind or low vision? And typically you would get one of three answers. The first would be the person looked like they, a deer in headlights and said, I don't think we have anything. Like, okay, that's a terrible answer, but it's an answer. The second was, well, I think that we can print out the labels larger, and would that help? And, in some cases, in some low vision cases, it might. And the best possible solution that people would say is, I think that we have something around here somewhere that might be able to read labels to people. I have to look for it though and figure it out. And of course, they might have been talking about Script Talk, which is a tremendous product that we fully promote and service at Accessible Pharmacy Services. But through all of this research, what we realized and the work done on by different advocacy organizations to try and make the overall marketplace more inclusive. Trying to do this with pharmacies is just simply exhausting. So we decided to make our own pharmacy, make our own marketplace that was specifically designed to be accommodating and as accessible as possible for the blind and low vision community. And I came together with my business partner, Andy Burstein, who had also been working in the accessibility space for developing an online tool to help retailers become, have more accessible websites. And we determined that, the best course of action was to create a pharmacy that really has two separate but converging paths. The first is to have the highest possible clinical footprint, where we're giving people the best possible opportunity to manage their medication, leading to better health outcomes, first and foremost. But on the other road, we're looking at accessibility and accessible accommodations and creating a more welcoming and inclusive environment where accessibility and these accommodations and welcoming isn't just an afterthought. The things that we do aren't just in case a blind person from the neighborhood comes in. We do everything because this blind patient exists and they're not getting the appropriate services that they should be receiving elsewhere. So we partnered with our chief medical officer, Dr. Jason Barrett, who has over 30 years of clinical pharmacy experience. And regrettably, he was unable to be on the call today, but we do, can certainly speak intelligibly about the pharmacy services that we offer from that standpoint. But I first want to start talking about service and introduce you to the services that we offer. So from the initial call that somebody would make with Accessible Pharmacy, we do everything for you. The entire idea of medication management is daunting and troubling to anybody. It's hard to manage your medications. Throwing in the added variable of sight loss just makes things just a little bit more challenging. So we do all we can to try and alleviate those challenges and making things more convenient. And and doing this, promoting greater independence, greater inclusion, and just an overall better experience. So during our intake process, once we have somebody's insurance information, and we accept all types of insurances, and nobody's copays or rates should go up as being a patient of accessible pharmacy. We do, again, accept all insurances and are especially adept at working with Medicare and Medicaid. But what we will do is we will become part of the patient's medication management team, their healthcare team. It's a collaboration. So we will, with their insurance information, we can contact their primary care physician, their cardiologist, their endocrinologist, their psychiatrist, their existing pharmacy, and have everything switched over to us. And so we can manage those medications, and in doing so, make sure that the patient is receiving the best possible care. Well, the cardiologist knows what the endocrinologist is doing, and we have lots of safety nets in place to make sure that people are taking the right medications. We also offer genomic testing, consulting, and a whole bunch of other stuff that we'll get into in a little bit. So we set everything up for the person. Now we do offer, we do have free shipping, and we use UPS or medical courier. So any problems that might be happening with the post office or delays you might have heard about isn't happening with Accessible Pharmacy. Also, we have active refill and reorder management, where we will refill the prescriptions each month and be able to ship those medications out to a patient the same time each month. Using UPS, and the patient can expect those, around the same day each month. We can put in special notes for with UPS where the package can arrive consistently and be put in one specific place, as opposed to being hid behind a planner or a different place each time. Being blind and going outside trying to find your package is never an enjoyable experience, but it will be consistently delivered through us. Now, also with the active reordering is whenever a prescription is about to run low, we will contact the prescriber and ensure that the continuity of care exists. There's no break in receiving the medications based on refills or reordering. We take all of those services for you. Now, also, we do recognize that the blind and low vision community is not a homogeneous community. People have all sorts of different variables, from support systems, ages, comorbidities, income, education level, you name it, we're all very different. And so we look at each patient as a unique individual, a unique patient, and we'll work with that patient on this individual basis to make sure that the medication management program, the regime that they're on, works for them. So we offer a variety of different packaging options. And I know Alexandra is going to demonstrate some of those later, but the understanding is, hey, we have easy open vials for patients who might have arthritis or dexterity issues. We have all sorts of different pill packing and sorting packaging that we can also include over the counter, or any vitamins or supplements that somebody takes on a daily basis. And that could be, separated by day or time of day, AM, lunchtime, PM, bedtime. And so we offer these solutions to try to promote consistent and adherence with medication regimen, and by doing so, produce better outcomes. So we're very dedicated to outcomes based research that we're promoting, just to show that our patients are doing better by being with Accessible Pharmacy. We also have a robust education system that is designed for the blind. I don't know how many blind people there are in the audience, but being involved with some type of instructional video that says, okay, if you tear off the red tab and turn the blue knob like 2 degrees to whatever, like, you know, clearly this will happen. I'm like, well, clearly I don't know what you're talking about because I can't see these colors and this isn't working for me. So we promote education and videos that are specifically designed for a blind and low vision audience where they're very descriptive and very thorough. Now, we are the official pharmacy partner of Be My Eyes, and I know that many people in the audience are familiar with Be My Eyes. But we, you know, as a part of their specialized services through them, we can offer help with prescriptions. Now, whether this is reading labels, pill identification, helping with measurements, or, you know, identifying how many puffs somebody might have left on their inhaler, what have you, as well as in-home COVID testing. We are there to assist our clients. Now, we also hire people from the blind and low vision community to work for us as sales and sales capacities, as well as our customer care representatives. So the people that you're speaking to on the other end of the phone get it. They truly understand the experience that a blind and low vision person may be having and those challenges, and are equipped to, you know, find solutions for those individuals. So I know that that was a lot to drop on you all at one time, but you know, we're very proud of the services we offer, and you know, I think that there's nothing else that's currently in the marketplace like us. You know, there might be certain accommodations here or there that you might find at other pharmacies, but nobody is doing the comprehensive medication management care that we are offering. So at this point, I'm going to turn it back over to Andy.
Nice. Thank you, Alex. I just want to add a few things, and then I'm going to share a few thoughts too. One is everything that Alex mentioned, everything that we provide, our consulting, our support, the way we interact with doctors, the delivery services, all the packaging and all the labeling, it's all free. We make our money by charging the insurance companies for medication, and that's how we make our money, but we don't charge anything for any of our other services. We've, you know, and also Patrick now, we actually met Patrick through the Connecticut OVR, and he's been working with us for a few months now, and he's actually going to be working in your territory as well. So our hope is that when the pandemic subsides, we'll all take a field trip up, and hopefully at some point this summer we can all do this in person as well. I just wanted to share a few statistics before I pass everything over to Alexandra. These are kind of alarming statistics, but I think it's interesting for the sake of our conversation. So I'll just read these off randomly. The majority of medical interactions culminate in a prescription. So when an individual goes to a doctor to deal with a situation for the first time, almost 90% of the time, a prescription results from that interaction. One of the more alarming statistics is that medication management errors, the mismanagement of medication, is one of the top 10 leading causes of death in America. Last year, there were 125,000 people who died in the United States because they did not properly manage their medication. The life expectancy in the United States is now, on average, 79 years old. Interestingly, Cuba has a higher life expectancy than we do. They're 80 years old. There are 30 countries throughout the world that have a better life expectancy than the United States. And, you know, financially speaking, like dollar-wise, there's $400 billion spent annually on prescription medication, of which 30 billion is wasted or never taken, and 21 billion is actually taken incorrectly. And so the statistics about life and safety and health, the dollar amount, you know, this is an issue. And when you add the layer of not being able to see what we're talking about, it becomes a bigger challenge. And it's one of the things that, you know, we as our company, as Alex mentioned, like we're outcomes focused. You know, our goal is to insert ourselves into this model of medication and really be here to support the blind and low vision and their extended families and caregivers. And so, you know, one of the things that we do, and we're really proud of is we've decided to, we look at all these different ways that an individual can interact with accessible pharmacy. And one of the things that we do real proactively is packaging and labeling. So they're two separate things. And Alexander's going to demonstrate and explain some of these things to you. There's no one size fits all. The best way for everyone here to manage your medication is different than the next person's. And so we have about 10 different kinds of accessible packaging and a whole collection of labeling. These are all free. And what we encourage our patients to do is pick up the phone, call us, have a conversation, try out some of the different kinds of packaging and try out some of the different kinds of labeling. And you can try different things every month until you find a package and a labeling that works best for you and your fit.
My name is Alex, Alexandra, since I have my other Alex on the phone too. And I'll just go through all the different packaging options that we provide for all of our different patients. And as Andy said, there's tons of different options and our patients have the ability to filter through them, see what works best for them, and work through them. If you don't like something, try something else another month. And until you find the right fit for you, we're here for you and I'm here to talk it through and try to find your best fit. So in regards to packaging, starting with bottles, we do offer standard bottles, obviously, in a variety of sizing options as well, though, depending on what a patient wants and or needs, as well as easy open lids for individuals that may have dexterity issues. So we have standard lids and we also have easy open lids. Additionally, we have child-proof lids for anybody who lives with small children in their houses. Secondly, we have disposable pill organizers. So at our fulfillment center in our pharmacy, we will pre-sort your pills in a pre-sorted disposable pill organizer. So I have a couple of examples with me and I'll explain them as well. So our pharmacy will pre-sort your medication, and that includes your prescriptions, your vitamins, your supplements, any over-the-counter medication. All of this can be included into a disposable pill organizer. Excuse me, and that organizer can be completely tailored to your individual specific medication schedule, depending upon when you take your medication, what day, and what time of the day. So for example, this is an example of a 30-day organizer, and it contains about 30 pill pockets. So each day, patients punch out the pills from that day's pocket, and they're able to then understand that I took my pills today, and then the next day, that day is now empty and the next day is filled for the next day. And the second example I have is an example of an organizer for 1 week. And this is organized for a patient that takes medicine 4 times a day throughout that 1 week. So this organizer is a little bit bigger. It's about the size of a piece of paper, about 8 inches by 11 inches. And this also houses different pill pockets for each day of the week. So there's 7 rows. But in this organizer, there are pockets containing pills for morning medication, afternoon medication, evening pills, as well as nightly pills. So it's a little bit more categorized for individuals who take their medication several times a day. And we can mail these out to you on a month-to-month basis. And they're already pre-sorted at our pharmacy. The burden is taken off of your shoulders to categorize them at home. You don't have to do that anymore. Additionally, another option is to get a daily pill packet. So these are also pre-sorted by our pharmacy as well at our fulfillment center. These are based on your daily medication regimen, just like a disposable pill organizer. These are completely based on when you take your medicine. If you take it morning and noon, just once a day, 4 times a day, 7 times a day, it doesn't matter. We can get the pill packets to replicate that and have them based on that regimen. And these can also include prescriptions, vitamins, and supplements. They're housed in a box and they come out. They're essentially, just small plastic baggies that are perforated to one another. So your pills are held in that bag for that time of day, whether or not, for example, if you take them in the morning, then your morning meds are in that small bag. And you rip off the bag, take your pills for that time. And then the next time you need to take medication, say you need to take it at noon, those pills for that time of day will be in the next available bag. And once again, they're housed in a box that you can pull the bags from. And we'll mail those out to you every month on a month-to-month basis from our pharmacy. It's already pre-sorted for you. The burden's off of your shoulders. On top of these different packaging options, we're really excited about the different labeling that we can add to it. So it's this whole other layer of labeling. So we're able to package everything in English, obviously, but also we're able to package everything in Spanish, as well as large font labels for individuals that may want their prescription and medication labels in a larger type. And additionally, we are expanding our Braille capability. So we underestimated the initial appeal of Braille, but a lot of our patients do opt to have as much as they can in Braille, and we really want to cater to that and to be able to provide everything for our patients that they would need. So we have upgraded from a grade 1 Braille embosser printer to a grade 2 contracted Braille label printer. So we're really excited about it. We're excited for all the capabilities we'll be able to offer with it. So like I said, with labeling, all these different packaging options that I'm talking about, those layers of labeling, large print, Braille, those can be included on bottles, on the disposable pill organizers, or on the pill packets. And oh, this is exciting. Another option that our patients can opt to manage their medication through is through the use of Script Talk. So if you are familiar with Script Talk, I am sorry that you're going to hear about it again, but it's really, really cool, and we are a carrier of it. It is a label reading device. So it's about the size of a clock radio. It's really simple. It comes with batteries, or you can plug it in. You simply turn it on and you use 3 buttons to operate it. How it works is a pharmacy adds a label to the bottom of a bottle. And then because the label is on the bottom of the bottle can now be scanned by the Script Talk device, and any information that's on that prescription label can now be read aloud by the Script Talk device. So I'm gonna demonstrate it for a second.
Using Script Talk.
Script Talk station ready.
Okay, so I'm gonna place this bottle with the corresponding label on the bottom. Oh, I'll press read.
Patient, Jane Washington. Medication, metformin, H.
So it's really user friendly. All you have to do, like I said before, it has 3 buttons, and the middle button is a read button. So all you have to do is press the center read button, place the bottle in the unit. The unit will start to read aloud the prescription information on the label. And then to stop it, simply press read again. And while it's speaking, you can press the other 2 buttons, which are next and previous, and that'll help the Script Talk device sift through the information on the label. Otherwise, it will quite literally read through the entire prescription label, which is pretty awesome for anybody who needs to listen to the entire label to read, nutrition facts, anything of that sort. At Accessible Pharmacy, we can put these scannable labels, they're called RFID labels, on all of our packaging options. So any disposable pill organizer, a pill packet, to have those prescription labels read aloud to you if you would like. For example, I have this disposable pill organizer that I demonstrated earlier, has one on the front cover of it. So I will turn the Script Talk device back on, press read again, and it will read
Jane Washington.
the information from the disposable pill organizer.
5 milligrams, 1 tablet.
And once again, if I don't press stop, it'll keep on going. All right. Another really cool option with Script Talk is if you don't want the device, you don't have to have the device. You can always just use their app. It has the exact same functionality. You just have to download the app onto your phone, and you can have your medication read aloud to you. It has 2 functions. It has a full scan and a quick scan mode. The full scan reads all the information on the prescription label, which is what we just talked about. And the quick scan mode simply just reads the name of the medication. So if you're just looking to, really quickly figure out what is in this bottle, the quick scan mode is really, really nice. I'll demonstrate that on my phone really quick.
Using Script Talk on your phone.
So you pull up the Script Talk app on your phone. The left-hand side of the screen is for full scan, and the right-hand side of the screen is for quick scan. You hit quick scan.
Metformin HCl 500 milligrams tablet.
And it'll just immediately read it aloud for you. So especially nice if you're, away from home, you don't have your Script Talk device on you, but you do have your phone on you. If you do have an
by the way,
iPhone,
the device itself is free. So if anyone is interested in the actual clock radio type device, Script Talk will coordinate with Script Talk, and they'll send you a device for free. So I'm sorry to interrupt you.
Oh, by all means, I don't mind. If you do have an iPhone though, you can use Siri to open up the ScriptTalk app. You can also use it to call Accessible Pharmacy, which is really nice. You can simply say, call Accessible Pharmacy, and Siri will call our pharmacy for you. I won't demonstrate it right now because it will do it for you. And you can also use it to open our own Accessible Pharmacy app. So we have developed our own app. It's very, very simplified. It's essentially just a camera that it pulls up a camera, and it will capture any picture of any, it will capture a picture, excuse me, of any text in front of the camera and read that text back to you. It's really simplified because we really just want it to be able to capture text in front of you, and that's it. Be able to read it back to you so that you, if you need to read something, that's what we want it to be able to do. The second functionality of it is that it will also capture any QR codes within range and read those aloud. But that'll be done after the text is read. So I will, let me demonstrate that really quick. I'll use one of the pill packet boxes that I have next to me as a demonstrator.
To view it.
All right. Actually, here we go.
The phone is now in camera mode. Hold the product a few inches from the phone and capture the text. If there is a QR code, it will be read after the text. Alexandra.
So that's my medication, so that's why I read that aloud. So we're really excited about that. It's very, like I said, it's very, very simplified. If you ever need something read, it's right in front of you. Just grab your phone, open up our app, just pull her up. She'll start talking to you, tell you exactly what to do. And then it'll read aloud the text for you and tell you what medication that is, so you know you're taking the right thing. Lastly, we're all huge advocates of Be My Eyes. We are the official pharmacy partner of Be My Eyes. We're super excited about it. This means we are on the specialized help button via the Be My Eyes app. I know tons of you are probably already familiar with it, but it is, if you're not, it is a video interface app that assists blind users around the world with an extra set of eyes if needed. As their pharmacy partner, instead of just everyday questions that somebody would need help with, we're just helping them with a little bit more intimate questions regarding medication, prescriptions, any type of question like that. We've been helping with implementation of a new device, reading of syringes, reading of labels, things like that. If you call us via Be My Eyes, you're connected with one of our pharmacy or somebody from our technician team. So we're really, really excited about it. And that concludes my demonstration of all of our packaging options. But once again, thank you for having me here too. And Patrick, thank you for having me too.
It was my pleasure, Alex. Thank you. That's an excellent presentation. And I know that if you're a consumer and this is your first time looking at us at Accessible Pharmacy Services for the Blind, we want to invite you for a free 30-day trial. And if you're in the audience and you'd like to just pick up a phone and call us, we're at 215-799-9900, and operators are standing by and they'll comfortably walk you through how it is that we bring you in and see to your needs.
For more information, go to accessiblepharmacy.com, phone number 215-799-9900. Contact Jerry Feliz, Access Technology Director for MabVeed. Email jfeliz@mabcommunity.org, phone number 857-443-6636.